Stephen Butler, and I'm one of the co-leads from UCL, and specifically involved in the core skills course. There should be a slide oh, it doesn't. There should be a slide that actually mentions we're a team, quite a substantial team, and you'll probably meet all of us today, I think, at some point. Nicola Bedman is involved, David Trickey is involved, we recently hired David Foreman and Peter Cooper. So we're really a group that is together to provide the core skills course. As Alex mentioned to you, it's grown from 40 therapists last year to 80 therapists this year. So we're embarking on a major challenge, which I think will be both challenging but also quite amazing when you think of it. Having 80 mental health practitioners in the room on a regular basis for learning purposes, I think it's actually a great opportunity. So I'm just going to tell you a little bit about the core skills program, and true to the 5-minute form, I just have three slides. One is on the goals. The first goal basically is to improve mental health practitioners' abilities to provide evidence-based services to children and their families. And I'm sure you're not surprised to hear that, you know, you've heard already. But rooted specifically in core CYP IAPT values, which are, of course, collaborative care involving young people, and this year we're going to also involve parents in terms of their voice in things, and also the routine use of outcome measures. Basically, what the course provides is empirically based or conceptual frameworks that are based in the literature to guide assessment, decision-making, and, of course, treatment planning with young people for addressing the major health problems that we face. The second thing is quite important. We realize that the challenge to embed routine outcome monitoring services is a major one, and part of what the core skills course does is to provide quite intensive input and support around needs. And finally, we really want to provide you with knowledge, methods, and a forum for integrating young people's views and parents' views into services. Last year, we involved young people directly in the teaching with a panel discussion around developing therapeutic relationships. This year, we want to expand that and involve them on 3 separate occasions around collaborative care, decision-making, and also service transformation. And we also want to have a session with parents as well. So we're trying to take this quite seriously and bring young people and parents right into the room, really, in terms of the teaching. So those are the goals. The process, which I think, I can't represent everybody, but one thing I've learned is the process in the core skills is, sits alongside the content as being extremely important. And I think we've learned a lot. This is our 3rd year, so I think we've been learning all the way along. First of all, we realize that professionals want to know just not why, but how to. And so we basically want to have the course integrated, providing rationale and the why, along with the how to, in a way that is, makes the learning satisfying and obviously relevant. So in order to do this, basically this year we're having the core skills teaching occur alongside teaching in the specific therapeutic modules, i.e. CBT, parent training, IPTA, and systemic family practice. So there's a real integration of the core skills and the core IAPT messages along with the specific therapeutic modules. The second is easy to say, hard to do with 80, but I think will hopefully be successful, which is didactic teaching made relevant. I won't spend much more time on that. But we do also complement the didactic teaching with clinical skills workshops with smaller groups and practice tutor groups. And this is vital and really a major bit of the teaching, which is that along with the larger groups, there's regular practice tutor groups where the therapists look at discrete segments of video and look at the skills and the abilities that they're developing and refining, really, in terms of child IAPT practice. Ecological validity. This is, to me, quite important, again, where there's been a huge amount of learning for us. And this is trying to integrate the HEI teaching as much as possible with the processes and systems and partnerships. So we're involving supervisors and managers along with the therapists at specific times in the core skills course, really to help integrate and embed the teaching into the partnerships. I think that's it in terms of learning. I think the last is around content, which I'm sure you want to hear a little, I'm sure you want to know a little bit about. And again, it may not be very surprising what we really want to focus in the core skills curriculum. One is obviously core IAPT themes, and that's really why we have core skills to begin with, is to take the core IAPT themes and to really embed them and integrate them into daily practice. So for example, I've already mentioned developing collaborative practices with young people and parents and families, and taking a look both at the evidence and hearing from the service users themselves. Also looking at outcome measures, and as I mentioned, actively using the teaching sessions to use those with clients, bring back your work, and to look at how these measures are working in your practice. And also I think what we've learned is things like scoring and interpreting the measures and really integrating them into larger formulations are obviously pressing issues for therapists, and we want to include this as part of the course rather than leave it up to people to do on their own. Finally, a few more things. One is what I call cutting-edge sessions on intervention that bring local practitioners who are delivering innovative evidence-based services. I'm quite excited about this myself because it's been a learning opportunity for me to really get an idea about what is going on in the partnerships and in different localities. So for example, by cutting edge, for conduct problems or antisocial behavior, we'll be bringing in some therapists who deliver MST and also who work for MAC-UK doing what they call street therapy. So we want the teaching to be as relevant as possible, but also to introduce you to ways of working that we call cutting edge, or that we think are integrating evidence-based practice with young people and families. Finally, part of what the core skills does is it introduces the basic therapy modules, which have expanded. So there's a grounding in what is common to these modules and what makes them a bit unique, or common to the treatments, and also what their unique contribution is. And finally, this has been another learning point, and it's been, I think, but quite a nice one, which is we've learned more and more how do you deliver a core skills course to a diverse range of mental health practitioners. So we wanted to develop the course that really pays attention to the student experience. One way of doing this in a very simple way is to work together to define your expectations and goals at the beginning of the course, to revisit those, and also to integrate those into sessions with supervisors and managers. So that essentially in 3 slides is the core skills course.